Mayor Eric Garcetti on Thursday, January 7, urged U.S. leaders to throw a lifeline to coronavirus-rocked Los Angeles in the form of additional vaccines, more trained medical professionals and other resources. Just after the mayor's plea, LA County public health officials announced more grim statistics: 218 new deaths, the third straight day over 219, 719 more cases, lifting the county's totals to 11, 545 and 871, 404, respectively, since the outbreak began. "I want to say loud and clear, vaccinations are not happening fast enough," Garcetti said, in a message directed at national leaders. Just as his city and county sent doctors to New York City when its hospitals were overflowing earlier in the pandemic, Garcetti declared that LA needs assistance during the as-yet uncontrolled surge gripping Southern California now. "We need more vaccines. Give Los Angeles what we need," he said. "This is our peak, and we need you." The city has plenty of firefighters, nurses and volunteers to increase the capacity to administer those vaccines in what is now an epicenter for the deepening pandemic, he said. "We need national leadership, we need vaccines and we need resources to pay for them," he said. "Give us those, and we know how to get the job done." According to the state, which updates hospital figures a day ahead of the county, there were 8,074 people hospitalized with COVID-19, a slight dip from Wednesday, with 1,635 in intensive care. County Department of Health Services statistics showed a total of 552 beds available in the county's 70 911 receiving hospitals, including just 34 adult ICU beds. The county's 70 911 receiving hospitals with emergency rooms have a total licensed capacity of about 2,500 ICU beds, although in recent weeks they have implemented surge plans and staffed a daily average of about 3,000 ICU beds. Given the rising case and hospitalization numbers, which health officials have warned will worsen, fueled by Christmas and New Year's gatherings, the Department of Public Health issued another warning Thursday for businesses to ensure they are fully complying with infection control measures. "Everyone in LA County, businesses and residents, needs to follow the rules if there is any chance we can get out of this surge by the end of the month," Public Health Director Barbara Ferrer said in a statement. "Every day we report a large number of people newly infected with COVID-19, it is like a reset on the clock for when we can get back to our recovery journey. I implore everyone to stay home as much as possible." The rate of people testing positive for the virus throughout the pandemic stood at 17%, but the current daily rate again exceeded that, at 24%. The county's daily update did not include the latest figures from Pasadena and Long Beach, cities that operate their own health departments.